Hi YouTube, it's Natasha, Mrs. N. Burns. Today is August 1st, 2011. I'm checking in for my 9-month and 40th week VSG post-op update. I had surgery on November 2nd, 2010. I was 285 pounds when I started this whole process. Today I got on the scale and I am now 184.2. I've actually been 184.2 for the last couple of days. Um, I had a doctor's appointment, which was my 8-month update about, I can't remember, it was either 2 or 3 weeks ago. It had to have been 2 weeks ago. It was 2 weeks ago. And on the day of my appointment, I was 189 with clothes on. And so my doctor was really pleased with my progress, which was a little shocking to me. I thought that he would have wanted a little more from me, but he seemed pretty good with it. You know, him and his nurses and everyone in the office told me how great I looked, and he showed me a picture from when I first had my first consultation in the office. And I had my boys with me, and he showed the picture to my 4-year-old, and my 4-year-old didn't realize it was me, which was really, really funny and shocking. And even when I looked at the picture, I mean, I realized it was me, but it's funny that, and maybe it's just me, but it seems like even though I know how big I was because I remember what the scale said and I remember what size clothes I wore, I never saw myself as big as I am in pictures. So it's really shocking to see pictures like, oh my God, I did not realize that I was that large. Still cute, but I didn't realize I was that large. So I don't know, it's kind of funny. So he and I, my surgeon and I, we also discussed my tummy tuck because he is a general surgeon. He practices general surgery and he also does tummy tucks. So he was telling me that I needed to lose another 10, 15 pounds from what I was then. So between 175 and 180. He would like to see me before Blue Cross will approve my surgery. So he said when I come back in November for my year checkup, I should, have surpassed that goal hopefully, and we can discuss my tummy tuck a little further. So my plan is to get my surgery, my tummy tuck, and hopefully a breast lift in January. I decided not to take off for Christmas and to just go and have my surgery in January and be off for a little bit of the winter and not have to deal with driving in the snow. My blood work all came back fine, with the exception of my vitamin D was a little low, so I'm on a supplement for a month, and then they'll recheck when I go back in November. He said my good cholesterol wasn't as high as it should be, but it's fine for my age. But he said if I were to exercise, it would get better. We did, I was honest and I told him that I have not been exercising, that I had a lot going on trying to finish up my last class and requirements in grad school. And he said, he was bragging to everyone in the office about how good I was doing despite the fact that I don't exercise. So although I really expected him to yell at me, he didn't yell at me at all. And maybe he should have, because maybe that would have motivated me a little bit more, but didn't happen. So I gave you my weight, told you about the doctor. That's about it. I finished my last class in grad school Thursday. I still have to finish up my final project. I asked for a 2-week extension, so hopefully I'll get that done by next Thursday. I'd like to turn it in by next Thursday. What else? I cut my hair yesterday. My husband and I went to the Jill Scott summer block party concert on Saturday, and I kept seeing all these women with really, really, really short haircuts. Um, what I called the menopause haircut because that's what my mom did to her hair when she started going through menopause. Um, but I don't quite have the nerve to cut it off because if you cut it all off and you hate it, then what do you do? But then I figure for like the last 4 months or so, I've probably just been wearing my hair slicked back anyway because I haven't gone to get it done since April. So what's the difference? It's going to look the same. But nevertheless, so I told my husband, I was bored yesterday. I told my husband I was going to attempt to cut my own hair because I haven't had a haircut in 4 months. I was going to attempt to cut my own hair. And I said, if it doesn't come out right, if I don't cut it even, then I'm just going to shave it off. And he's like, okay, go for it. So I cut it, and surprisingly, I think I did a pretty good job. And I know you all can't really see. I cut about 2 inches off the top, maybe an inch and a half off the top, 2 inches on the sides, maybe, and in the back. And looks pretty good. Like all day at work, people were saying, "Oh, your hair's so cute. You got your hair done." I'm like, I did it myself. Cut it myself. I'm fresh. Anyway, so um, that and what else? Clothes. I am still wearing a 12 in pants, although my pants are a little loose. They're loose in the thighs. They're definitely loose in the butt. Um, Not loose in the waist to the point that they're falling down. So I'm not quite sure if I could get into a 10. A 10, I could probably get into a 10, but it might be a little too tight. So I'm going to stick with my 12s for now. In dresses or shirts that t-shirts and things that just pull over my head, I'm in a medium. I've decided I'm not going to buy larges anymore because they don't hang right and they're too big. So a medium. I have a couple dresses that pull over my head that are mediums. Um, don't know that I have any shirts that are mediums, but everything I buy from now on will be a medium shirt. Because even I have a couple dresses that I really, really like, and I bought them in larges, and they're too big, which really hurts my heart because I probably only wore them like once or twice, and they're really cute. But it is what it is. The price we pay, I guess. So, I think that's about it. Just wanted to do an update. And I need to post some pictures, do a body shot or something for you all. Don't want to do one now because I have on workout shorts and just a tank top. And I don't mind the tank top so much, but the upper body isn't bad at all. As you can see, my bones show. I mean, my arms are flabby. I'm not even going to show you my arms. They're disgusting. My arms are flabby, but, you know, I'm going to try and work them out. I'm going to try to avoid getting that surgery done. Work them out as best I can. It is what it is. When you get older, and I'm only 33, but as you get older, most older people have the back wings or whatever. So who knows? I might get surgery and then 15 years down the line, they look the exact same way, which will really piss me off because I spent all this money on surgery. But anyway, so I'm going to try and work my arms out and avoid the surgery. Boobs, deflated, definitely need a lift. Stomach, need a tummy tuck, but it's really not that bad. If I didn't get a tummy tuck, I mean, who's going to see it? It's very hideable in clothes. It's not horrible. Some people have much more than what I have. But the butt has disappeared, and my thighs poured. So I'm not going to give you all a body shot with these little shorts on. If I had on a dress, I would, but I don't. So next time, I promise I will do a body shot. I don't know that I've taken any full body pictures lately that I could post, but I'll look through my camera and my husband's camera and see. And if I have, then I'll, do a short um, photo collage video, I guess. But that's about it. Thank you to everyone who has recently subscribed. I have been doing a horrible job of keeping track and subscribing back, so I do apologize. But I appreciate you all following my journey. And good luck to anyone who has recently had surgery or is about to have surgery or thinking about having surgery. I wouldn't change this decision for anything in the world. Um, been one of the best things that I have ever done for myself. And I guess in doing it for myself, I did it for my husband and my children also. So, with that said, it is getting late here, so I probably need to get my stuff together and go to bed so I can get up and slave away at work tomorrow. So you all have a great week, and I will talk to you all soon. Bye.